Hello, I'm going to show you two more of my anti-rejection immune suppressant medications that I take. I have had a kidney transplant going on 3 years now. The first one is this one here. It is called Rapamune. And with this particular pill, it's not usually given right after your transplant. It's normally a while after, I would say at least a year, if you have to switch like I did. I was originally on something called Prograf, which I was having severe headaches. So to try to help me with that, they switched me to this one. But this one, like I said, it's not given like right after your transplant. Normally right after a transplant, I think they give Prograf. And I know they used to also give something called cyclosporin. I'm not sure if they actually still prescribe that one. But this right here, which is the Rapamune, it can be used as an immune suppressant like I use it, but it's not normally given right after your transplant. And this here is prednisone. Prednisone has a lot of uses. It is actually a steroid. I take 5 milligrams once a day of this, and the Rapamune I take 3 milligrams once a day. And with the prednisone has side effects that some may be familiar with because it's used with so many things. Prednisone can cause weight gain, and it can cause also what's called moon face. That's where your face just gets round. You can tell the weight gain in your face because it gets a round shape, kind of like a half moon. I guess that's where they get the moon face from. It's not so pronounced that it's just, oh, it's such a bad thing, but me taking prednisone, I can normally tell if another person is taking it by looking at them because I'm familiar with the side effects. Prednisone can also cause elevated glucose levels. So normally after transplants, I know if a person is diabetic, they don't prescribe prednisone. A friend of mine also had a transplant. We became friends at dialysis. She was not prescribed prednisone, although she is a diabetic. So I guess that's too much of a risk, but being that I wasn't a diabetic at the time, prednisone was also one of the medications I was prescribed. It's a steroid, and it just works well with the other anti-rejection medications. Getting a kidney transplant, you get a lot of medications at first. Some they may taper off, and some will be for a lifetime. But prednisone is just one of those that could be the main one, or maybe they taper it off. I don't care how many pills I have to take, as long as it keeps my transplant healthy. Hey, I'm fine with that. I'll take pills any day over going dialysis. Okay, and the Rapamune. The side effects are very similar. The only difference is I can tell you with the Rapamune, and if you heard me speak about my Fortic before, between the two, they also can cause elevated cholesterol and high glucose levels. The prednisone, the Rapamune, and also my Fortic all work together for the greater good of your anti-rejection meds. But between these two and the other one I spoke of, it can cause elevated cholesterol, which the doctor can just prescribe something for that. You can take something for it the doctor prescribes, which I do. But like my doctor explained to me, changing diet and taking medication will not lower your cholesterol, but it will help. The cholesterol level is just a side effect of the medication. So the Rapamune and prednisone are two more anti-rejection medications I use. But like I said, prednisone is used for lots of things. I know it can be used to treat asthma. I know it can be used to treat, I know some people have certain eye disease. I don't know how it actually interacts for them, but I know it's used in other cases besides transplant. But prednisone, steroid, works great with my other medications. That's the Rapamune. And I also have another little tidbit about this, my Fortic. But that is just a little information about my transplant medications.